All right, good evening. We have some people rolling in this evening. And once again, thank you for joining us. Scott Stoll from the Plantrician Project. And we have our dear friends from ProNex, Karol, Deepa, and Sumit again here with us this week. I just want to say that if you missed last week, if you're watching this on the recording, if you're with us live, please go back and watch last week. I've been in lifestyle medicine a very long time. I've been practicing it for more than 20 years. We used to host a workshop at our conference on the finances of a lifestyle medicine practice. And Sumit last week did the best presentation on the finances and the insurance billing for group visits and lifestyle medicine that I've ever seen. So I just want you to be aware that that is the most valuable resource on this topic that I have seen to date, and I don't want you to miss it. And why is it important? You know, it's evident to me because I was just seeing two patients last week, and one patient said to me their monthly expenditure for healthcare is $2,100 with a $7,500 deductible. The patient just following them was $1,500 a month with a $7,500 deductible. And so with the challenges in our economy and the rising expenses of healthcare, people are struggling on lots of fronts. And while we would love to build cash-based lifestyle medicine practices, it's difficult today. And the good news is you don't have to do that. As we're going to learn this evening from Sumit and the ProNex team, there are validated, qualified, and financially robust pathways in place for you to gain reimbursement for delivering the best quality lifestyle medicine. And so we're delighted to welcome back Sumit and Karol, and thank you for joining us again this evening. Karol, I'm going to turn it back to you.
Awesome. Well, welcome back to everybody. We are so thrilled to have you here, and hopefully at this point in this mini series, you've felt hopefully the love from all of us and the desire to really help you succeed on all fronts. As Dr. Stoll mentioned, from setting up your practice to what sorts of model you're going to have and all that sort of thing. We've covered so many different topics. Today is metrics that matter, and this is one of the things that is really important from a diagnostic perspective when you're having difficulty in your practice, and also setting things up right from the very beginning. So we're going to be diving into that tonight, and then next week we'll talk about long-term adherence. So a quick recap, as Dr. Stoll mentioned, last week was so valuable. Sumit did talk about quite a bit about how you can create a scalable revenue model with two levers. One was care delivery, how you're delivering your care, and the second one was your revenue model. And he explained everything to a T with examples, so I really do also encourage you to watch that if you haven't already. Tonight, we're going to be talking about the three questions every practitioner cares about, metrics that matter from an operational perspective, strategic, financial, marketing, team KPIs, and then, of course, patient outcomes, which is at the heart of what everyone does, what to look for in a billing company, and then a little bit of homework, light homework, and what's going to be covered next week. So with that, we'll go ahead and move forward.
Cool. Thank you, Karol. I'll gloss over this because we talked about this last week as well, but just want to share a little bit of my background. I've been in healthcare pretty much since birth. Started with my first RCM company back when I was in high school. It was a family-owned company. Worked with a lot of lifestyle health, early RPM platforms, early collaborative care and lifestyle health platforms over the years. So a lot of the things I'll be talking about tonight are metrics that matter for both the clinical and the financial side and help you as physicians and practitioners run successful financial businesses.
So all along, we have been driving this series with two characters of our story of launching and scaling the lifestyle medicine practice series here. And we have Maya and Dr. Marcus, our story characters. Both of them potentially or hypothetically can be or could be working in different settings. So all the information that we are giving We want to make sure, or we have tried to make sure that it is applicable to any healthcare professional, uh, any doctor in variety of settings. So how we tell our patients to have an open mind to behavior change. I'm going to request the same out of you. Don't feel that, oh my goodness, I'm stuck in the cash only model or insurance only model. There are multiple ways to start the practice, scale the practice, and grow. One thing I want to make sure that we have clarity on: lifestyle medicine reimbursement is nowhere like it was even just few years ago. I would say 5 years ago. Forget about 20 plus years since Scott and I have been working. So lifestyle medicine practices can be extremely fulfilling, and if we do it correctly with proper uh, uh, tools, techniques, strategies in place, it is the most enjoyable thing that you will ever have. So without further ado, I'm going to have Sumit take over and take it to the next level.
Thank you, Deepa. So, sorry, my slides. There we go. Um, as physicians, as practitioners, as business owners, it's when you look at healthcare data, when you look at both financial and clinical data, it seems like a lot. And that's why I like this image here, because a lot of times when you're at the end of the day or when you're on the weekend reading your charts or reading your financials, it's hard, right? And it doesn't need to be complicated. It is complex, but it's not complicated. And I think from in healthcare, we are nowhere near data poor. We have all the data points that you can think of on people, on insurance companies, on billable services, on codes, on diagnoses. And what the issue is that we're context poor. A lot of times when you're running a practice, you're just getting those very, very long Excel reports that will have I looked at a report today as I was doing an analysis for a practice, and it had like 200 columns across. And every row on the report was a different CPT code. It wasn't in order by all the services that were done for that patient on the day. And looking at that, it's like, what the hell am I looking at? And why am I looking at this? Because it's impossible to get information out of it. So, there's a lot of studies out there. Healthcare is gaining more sophistication from a technology standpoint and a data standpoint, but still, like 74% of CFOs or financial officers in healthcare practices say they have the data, they just don't know what to do with it. They don't know how to translate it into an action, how to improve their business. And then other studies, there's a lot of studies on the denial standpoint and just recoupments and all the different ways that money can be lost or wasted. And the number that's come out recently is there's about $262 billion lost to claim denials annually. Recoupments, if you keep up with CMS recoups amounts in the hundreds of billions of dollars annually. And CMS does this typically 5 years after the fact. It's not like, hey, you submitted a claim wrong and they're trying to get your money back. It's years later. So the problem isn't the access to the data. It's how do I understand that data? And at the end of the day, every data set, every dashboard, every report you look at, it's a story you're trying to tell. And you as a consumer, as a provider, as the owners of these businesses, you're the director. What story do you want to see? And how do you want to see it? And it's communicating with that right billing partner, that right technology partner to surface the information that you need to make the right decisions. So where does the data come from? And what are the metrics that matter? And I think the first thing you need to understand is where are all your disparate pieces of information. If you work in a health system, you may have Epic as your main system of record, but then there's also you can have a third-party billing company, you can have all the clearinghouses, you can have the payer portals. You can have a point solution for AI. Up until recently, Epic didn't have an ambient scribe, so you can ascribe information in other parties. So you keep all these sources of information. They're everywhere, and understand what various sources you have. Do an exercise of over a 1 week or a 2 week period. Everywhere, or where are you looking at the information that matters to you in your practice? Write it down. I think that's a good piece of homework to understand what that is, and then finding the right partner to structure it. How do they pull it out of the systems? How do they normalize it? Because all these systems have different headers or different terminology for the same field. Like, um, I can't tell you how many different ways I've seen CPT code listed in a report. It's CPT code, it's procedure code, it's procedure, it's code, it's CPT, it's HCPCS, and that's just a few. So it there's a lot of different ways people name their information, and finding a way, something in the middle to normalize it for you to be able to then organize and enrich into a visual that you can understand. Because that Excel report with 200 columns, trying to have, if you have a million rows, how are you going to be able to read it? How are you going to get an outcome out of it? You're just going to sit there with your hand on your head, frustrated. So taking that data and structuring it. And once you structure it, there's really three questions that matter. And I've worked in a variety of industries in my career. I've worked in the entertainment industry. I've worked in warehousing and shipping. I've worked in lighting. I've worked in like event management. I've worked in healthcare. Everything really comes down to from it should answer one of three questions. Any metric, anything you look at, and this applies to every industry. What did I send out? Like, so what did I invoice? What did I bill an insurance company? What did I bill a patient? What did I send out where I should receive some form of a financial? And which goes into the next section. What did I receive? What did I get paid? Why? What's outstanding? Now, what did I bill out? What did I get paid? What didn't I get paid? What did I bill out? What did I get paid? What did I get denied? What did I bill out? What did I get paid? What hasn't come in? All of it is all coming to these three questions. And if you're structuring information and creating your story as you're building these dashboards or building your data set with your partner, or whether you do it yourself, if you're not answering one of these questions with that data point, with that, if you call it a widget, that visual, whatever you want to call it, but if you're not answering one of these questions, it's noise, it's waste, it doesn't help you. Don't waste your time. And on the slide for what did I send out, some good like industry rates people look at are clean claim rate, charge lag. What charge lag essentially is basically from when you saw the patient to when the claim was billed out. Your clean claim rate is what percent of your claims are getting paid on the first pass. What are cleanly going through to the insurance company and the insurance company is processing. What did I receive? Your NCR is net collection rate. What did am I getting from a certain payer? Am I getting my contracted rates? That ties to what did I receive? What's outstanding? How long has stuff been sitting in AR? What are your denial rates? Like that previous slide, there was over $200 billion lost to denials because many people don't look at it. There are insurance carriers out there that have a line item on their budget because they will just automatically deny all claims, and they know that the litigation is probably cheaper than paying out in the front end because many people will not look at their denials and fight them. Many times a denial is errant and it's just not necessary. All you have to do is supply a copy of your medical record and it will get paid immediately. Best in class, I would say in AR, if it's under 35 days, you should be under 35 days in AR, and it should be around under 12% of a denial rate. That denial rate is raising. and rising because of the difference in payers. Like Medicare Advantage plans, Medicaid MCOs, all these new types of plans that most of the time patients don't know they have. They could have gone to a dinner and gone home and they have a new insurance carrier and they don't even know it. So it is important to look at these three metrics and these three questions, because it'll also tie to how do you improve your business. If your denial rate, you're seeing eligibility is a major denial, you have to fix that on the front end. Or you're seeing your coding or becoming major denials as a provider. There's rules with the Medicare NCD and LCDs that tie to which diagnoses are acceptable for certain codes. So looking at your denial rate will help you improve on a go forward. But also, if you're fixing those denials and you're avoiding them in the future, you're speeding up your time to get paid. Every denial, every issue is a touch. Every touch has a cost. Every touch, more important than cost to you as a provider or you as a business owner, has a time problem. And there are some businesses I've looked at that their average days to get paid is right around 30 to 45. Some of them it's 180 to 200. As a business, you can't float. You're basically giving a free loan to the insurance company because you're not billing correctly. Digging a little deeper on what are some metrics worth tracking. We talked about some of these on the last slide, but operationally, it's the engine. Is it running? Are there small problems? Denials is the first thing that tells you that your engine is failing. If you have a low denial rate, your engine, your machine is running smoothly. How long are things taking to get paid? Clean claim rate and charge entry lag. These are the same things. This is just that last slide separated out just a little differently and in ways you should look at, but operationally, financially, and strategically. With what's happening in lifestyle health, strategic is very, very important, because if patient responsibility is changing or you're changing from a cash pay to an insurance pay business, how is the payer working? What are the new codes that are coming out? Every year, Medicare announces a proposed rule and a final rule that helps you understand some of the new codes that could come out. Like health coaching is coming out. There's different codes for food. There's different codes for exercise. There's different codes for, like we talked about last week, remote patient monitoring, collaborative care, chronic care, primary care, advanced primary care. There's new codes that come out that you can take advantage of as a provider because you provide these services. So strategically looking at the payer mixes, looking at the insurance companies you accept, sign up for their newsletters. Many times the insurance companies have a newsletter on new things that are coming out. You can look at CMS every year, like clockwork. July and November is proposed and final rule about new services that are coming out and how you can take advantage strategically with these new services, which will only help you operationally and financially. Raise your margin. Every single dollar counts. Now, many providers, most of you went to school to treat patients. Not all of you went to school to run a business. So find a partner. What do you want to look for in that billing company partner? Now, I think table stakes, just entry, transparency. If a billing company tells you, hey, we just send you a monthly report and it's just a canned report, you can't customize it, they're not the company. You need something that gives you more flexibility. Real-time dashboards are great. Not every company has those yet, but they'll have flexibility in giving you customized reports. And it's not this this long PDF packet for you to look at. It's actually a small report and structured and catered to what you want to see as a provider. And part of that reporting should be denials, so you can look at it as a provider, but then also that the billing company is actively trying to fix those denials. So if you have an eligibility denial in month one, and like that's your biggest denial is eligibility, if that's still your biggest denial in month four and month five, and there haven't been any strategic changes by the billing company, whether it be I call them billing rules in my environment. Some people call them their processes or SOPs, what have you, but they haven't built rules to try to avoid this, or they haven't fought these denials to improve. They're not preventing. They're not helping you as a business. They're just they're taking their cut to submit claims and be happy. And while I am a billing company, I know many billing companies just are there to submit claims. They're just entering the claims. They're doing the lowest hanging fruit and not trying to help you grow as a business. They should be growing with you. So making sure that they have a team or a person that is focused on that denial prevention and management, looking at the information, reviewing it, building some processes to actually get you paid quicker. Um, Lifestyle medicine is still newer from the insurance standpoint. So making sure whatever billing company you have, they have certified coders. The most common coding certification is CPC. They have a CPC certified coder, but also they understand your space. Are you doing all of lifestyle medicine? Are you focusing on obesity? Are you focusing on preventative care? Are you focusing on diet and nutrition? But making sure that they have some expertise in that space. This is a little bit harder to find, I will say, because this is still a newer service. Not everyone has learned it yet. But again, if they're a newer company, they're willing to learn it, it could be valuable to you, but make sure they have an understanding of it. They're not just a generalist company that they're digging in. They have those certified coders. Integrations. I can't stress this enough. If you look at a billing company that doesn't have any type of integration, they're not for you, again, because making sure that flow of data between your EHR and your PM is clean is everything, because otherwise what they're doing is they're entering data. Now, I don't know about you, but when I'm typing, I feel like I have fat fingers all the time and I'm making errors and mistakes, and that's fine because I'm not the one entering a claim that's tied to payment. Like if I make a misspelling on an email, no one's going to care. No one's going to call me out on it. But if you misdiagnose or miscode a claim because of a data entry error, you get denied. And each denial costs you at minimum 30 days longer to get paid. You've already waited 30 days to get a response from a payer. Now it's up to 60 days just to get paid because of data entry errors. Those integrations are everything. Making sure there is an integration. And I think one thing that's not on here as well is what does their additional tech stack look like? Because if they are a very largely disparate tech stack, then them trying to translate all that information into one becomes difficult. Do they have integrations with any additional AI products that they're using? Or do they have their real-time dashboard? Is that tied to a PM? Have they built it their own? Is it a third party? Understanding some of their tech stack and additional integrations will be important. Pricing. I think pricing I have seen unique in some companies and special, and it's usually tied to there are some laws around it. Certain states they cannot legally charge you a percentage of collections, so know your state, do a little research. Certain states you have to pay a sales tax on your billing company. Certain states, the most common way of billing from a billing company is a percentage of collections. They take a cut. They're like your if you're an athlete, they're like your agent. They're taking a cut of everything you're collecting. And make sure that that's fairly transparent. And I'll give you an example. I did an analysis for not a lifestyle health provider recently. For this was a derm and plastics practice, and I offered them a 5% deal. And they said, you know what, our deal's 3%. Can you match it? And realistically, there was no way I could have matched it at their volume. And I said, you know what, let me look at your invoice. Let me just do a comparison for you and let's see what our invoices would look like. And Mine was a flat 5%. So if they were making, and I'll use 100,000 as an example, if they were making $100,000 a month, I would have taken five. This other billing company was charging the 3% plus $1,000 add-on for mailing, plus $1,000 for an invoice, plus $1,000 for a wrap. And they were actually paying $8,000 a month. So they were really paying an 8% fee instead of a 5% fee. So really get an understanding of what that total fee will look like. I can't stress this enough that many times they'll just tell you the flat fee and there'll be stuff hidden in the contract. So read the contracts, get an understanding of what the termination looks like, get an understanding of any additional onboarding or platform fees. A lot of the new billing companies who are tech forward, AI forward, have their own platforms. So they charge you a monthly platform fee on top of their collection percentage. So look at all the various things you can be charged for and what any penalty is if you're to change. But very detailed, read your contracts. And I'll say there are a lot of billing companies out there. A lot of them are great. A lot. Find the one for you. Don't just go with the billing company because they're the name brand. There are some name brand companies that many people hear of, like the R1s of the world, because they're the first publicly traded RCM company. But if you as a lifestyle medicine provider went to an R1, in all honesty, you're going to fail because they're hospital billers at heart. That is what their focus is. So look at their specialty specific expertise. It's important to look at what are they outsourcing, what are they insourcing. There's some companies that are like just one individual in the US and they're outsourced to a third party and you're just paying that up fee. So let's just revisit what we've talked about so far today. We've talked about a lot. We've been quick, but metrics that matter to you. From a financial standpoint, all the services, all the care that you are providing, are you earning a profit on that? Now, I know that's hard to think about because many times as providers, you give care because it's your job, right? You have to make sure your patients are healthy. But there are a lot of things that you are probably doing that you are probably not getting paid for. There are probably many things that you are doing that you can be paid for. And there are many things that the insurances will pay for that you do not need to bill cash. And then I'll hand it to Karol to talk to some of the marketing and the KPIs, and Deepa can maybe talk about patient outcomes because I'm not clinical. I cannot speak about those metrics.
Well, thank you, Sumit. I mean, having been and still currently functioning as a practice administrator who's dealt with insurance, the information that you just gave is golden in terms of taking a situation where you need to correct it, or if you're starting out from fresh, starting out in a really positive way. So thank you so much for that information. It was really spot on. And I want to talk a little bit about, I know we spent some time talking about marketing before, but we're going to get into just a few other metrics because these other metrics are important as well. A lot of times we get focused on financial, but we also have these other metrics to be discussing. Marketing is one of the metrics. We want to make sure that the right patients are finding you and becoming active patients. So by the end of this discussion, you'll have the metrics that Sumit shared, and I'll also just give you a couple of top line ones. I have more that I like to track, but the top line ones that I think you need to address. So are they finding you and are they converting to patients? Team KPIs are so important just because to build an A team, you need to make sure that they have some skin in the game. And most employees, if they're really A players, they want to be a part of your practice and they want to understand the trajectory of where you're going and how they can contribute in the best way. And so a lot of times, if you have frustrations, you can take those and turn them into team KPIs and have them have some ownership for that. And it can make a huge difference in your practice. And then finally, patient outcomes. What is the real world impact of your program? I mean, Deep as a dietitian, I'm a nurse, but we're all in this because we want to make sure that our patients are getting good outcomes. So that's the other thing. So the next slide, Sumit. Great. So This is more yours, kind of a
Yeah.
reiteration, huh?
Yeah, these are just a reiteration of some of the high level financial metrics that matter. Your net collection rate, 95% should be expected. If you're under 90, you have a big problem. And figure it's going to be in the denials. It's going to be in that information somewhere. Look at your revenue per provider. There's a lot of comparable lifestyle medicine programs through the nation, and how are you doing against those? Are you taking advantage? And what's your margin? There's because in your program throughout the weeks we talked about there's shared medical appointments as well. So you can scale your time of the time it takes you to do one appointment, you're actually getting paid for 5, 10, 15 because you're using those group visits. Also mix in what your cash pay and your membership revenue looks like because as lifestyle health providers, you have been doing a lot of cash pay over the years, and make sure you're utilizing that and understanding where that fits in your business and how that's comparable. And how much does it cost you to acquire a patient? How much does it cost you to grow? And when you look at that against the lifetime value of the patient. What is that patient worth over time?
And then some of the other metrics that really do matter from a marketing perspective in particular is your lead to conversion rate. And Sumit just talked about, your cost per acquisition, but that plays into marketing as well. We want to make sure that if you're spending any money on marketing or whether you're really ramping up your organic efforts, that you actually are gaining the leads and that you're converting those into paying patients. So this is really just the percentage of leads who become paying clients. And I personally like to track lead to consult, meaning how many leads did you get in? And this is another place. I know in ProNex, we have this wonderful dashboard where people can connect through any digital door. They get right onto your dashboard. You can track them through there, reach out to them, but you want to make sure you have a method to do that. So you know exactly how many leads are coming to you, whether they're referrals or somewhere from the digital door on your website or somewhere else. We want to make sure that you can track how many leads you got, how many turn into a consult. And then, in addition, how many that had a consult that turned into paying clients. This is information that gives you a way to see if your percentages are low. Just like with your finances, we can dive deeper into why are they low? Is it somebody who's answering the phone that isn't quite as friendly as they should be? Is it someone who you're not following up with them quick enough because there's lots of choices out there, so people are searching. So there's lots of different ways, but this is really important to know. And the lead to consult rate, you can see anywhere between 30 to 50% is usually typical. And a lead to paying client, if your consults are run very well, this says 60 to 75, but I've seen it much higher than that, even in terms of percentages. So that's an important metric to follow. The other one is your referral rate. Where are your referrals coming from? If they're coming from other practitioners or your patients, that's the least expensive, but yet the best way to get clients through your door because they already have a lot of trust. They've already heard how wonderful you are. They're coming in. So we want to make sure of all the referrals that all the new patients that you have, what's the referral rate from physicians and patients? And we want to nurture that along. The third metric that I would like to also add here is the client lifetime value. Oftentimes, we don't really look at this, and whether you're cash pay or whether you're insurance based, if you can take a look at the total revenue that you typically get from a patient in a month, let's say between insurance and copays, all that sort of thing, you're getting $350. If they stay with you for 10 months, that's $3,500. If you actually have a retention up to 15 months or longer, even for 15 months, that amount goes up to 5,250. So if you're able to attract the right people, treat them well, get them the outcome that they want, and have a way for them to continue through with you and your program, it can actually create a much higher a value for you in terms of revenue. So that lifetime value is important. The other item is program completion and retention rates. And patients who complete your program and those that remain engaged over time, that's what this is measuring. But this is a sign that you're able to keep your patients engaged. Engagement is a hard thing to measure unless you have software. And I know I'm biased, but in ProNex, we have a way for you to track engagement, everything related to all the 6 pillars. And it's a wonderful way to see, and it's a wonderful way to keep people engaged so that you increase your lifetime value. value and that you know that they're going to complete their program. Behavior modification, as we all know, is hard. So we need to make it very engaging and be able to track that. And then another metric is team efficiency metrics. We call these KPIs or key performance indicators. This will really reflect how well your team delivers care and the patient experience. But even beyond that, this is something that can relate to every different aspect, even in finances. I was just working with a client who had a really poor copay collection rate. It was dismal. It was about 25%. I know Sumit's probably going, oh my gosh, what is happening? But, we had to put KPIs in place. We had to give expectations for their team and make sure they had the training so that now they're up to 95%. And it made a huge difference. They're not chasing everything behind the scenes. So if there's a frustration in having effective KPIs in place for your team, is a something that's really important. You can even make this very fun. Like, let's say we're trying to increase our reviews because we want to make sure that we're being seen and AI is finding us and the patients are finding us. They look at your reviews immediately. To put a KPI in place for your team, whether they're virtual or whether they're in person, we're going to make an effort this month. Our goal is to get 20 new reviews. Then you break that down into the weeks, and then we track that and we report back. And it gives people incentive as a KPI to understand what's important to the business and to the patients, and then to take part in making that happen. It really is something that's very, very effective. And then, of course, the most important is patient outcomes, reflecting what the real world impact is on your program. And this is also very necessary for those of us anyone that does research, anyone who's tracking, aggregate data, and particularly in lifestyle medicine, it's so much on the forefront that this is so important. So being able to track your patient outcomes. And I mean the ones that are measurable in terms of blood pressure, glucose, weight, those sorts of things, but also the non-measurable things. In your software, if you have a way to track, how are they feeling about themselves? What's their energy level? Did their sleep improve? All those things are great metrics that you want to track in terms of patient outcomes. So those are just a few other metrics that matter. And it's a matter, just like Sumit said, make it simple at first, just pick one thing, track that, and then add another one in and have a dashboard that you can share with your team and you can all get excited about. That's what's really going to help move the needle forward in terms of building that practice that you thoroughly enjoy, your patients are enjoying, and you're getting the outcomes that you want. Deepa, did you have anything to add to any of that?
Just one thing about the patient outcome, because whether you are a single provider or a community organization or FQSC or a hospital or an insurance company, it doesn't matter, because the financial reward, so to speak, in one way or the other, is tied to the patient outcome. And I'm not just talking about the clinical outcomes. So the requirement is, you need to get, let's say you are an FQSC and you want to get the A1C levels improved and blood pressure and cholesterol levels improved. And that's where the funding is tied, correct? So if you don't have right systems in place to get the patient in the door, stay in your house, short term, long term, or you don't have a system to re-engage because life happens, right? Then the patient is not going to stay. So now your clinical outcomes are going to get shaken. On the back end, now you don't have patient visits, so that's going to affect the billing and the financial reimbursement. So this is all, it's a ripple effect leading to the positive or the negative outcome for the practice or for your work setting. So it's very important that the outcome, the word outcome, needs to be looked upon. It's an umbrella term, and it's A to Z process that we need to evaluate.
Awesome. Dr. Stoll, you always have pearls of wisdom to share as well.
I mean, this is such valuable information. And I don't have any additional pearls except to say that, as Sumit was saying, the most important thing is having a system that you trust and people that you're working with that are trustworthy and that are keeping up on these details. You know, all of us went into medicine to practice medicine. None of us really were trained in the, as you said, Carol, in the details of running and administrating a business. And so in you know, one of the most important concepts of efficiency is to do what you're good at and hire people to do the things that you're not good at. And so, you know, partnering with the right billing company, partnering with the right administrators is really essential. And then it frees us up to take all of that off of our plate and to do what we love to do, which is help people, why we went into medicine. And so I'm really grateful for all of this information. I think it's truly invaluable. And I'm glad that it's recorded because this is going to be a fantastic course for people following this call. So thank you very much, Sumit and Carol and Deepa, for organizing this and putting together such a valuable resource.
Well,
Thank you, Scott.
yeah, thank you.
Thanks, Carol.
Thank you. So we will have, as always, the replay coming to your inbox along with a little homework sheet so that you can utilize that as well. We are always available for any questions, have some contact information there for you for Deepa, myself, Sumit. And if you have any questions, we welcome that. Like I say, we're here to help everybody that's a part of the series and beyond just be successful. So anyhow, I think that's what we have for tonight. And I want to just say thanks to everybody.
Yes, thank you for all
everybody.
joining us. And I would just ask all of you that are either live tonight or that are listening to this on replay to share it with somebody, a colleague, a friend, because this information really is essential. So please take some time this week to forward the invite or forward the replay of this, because we want to get this information into as many hands as possible. So thanks for being here, everyone, and we will see you back here again next week. Thank you, Carol. Thank you, Sumit, and thank you, Deepa.
Thank you.
Thanks, everybody.
Thanks,
Have a great
everybody.
night.
You
Take care.
too.
Bye.
Everybody.